Assalamualaikum dear doctors. In this video I am discussing a video station. So first we will watch the video, then I will discuss what type of question we can expect from this video station. In the case is suppose a 5-year-old child who is sitting in a couch and the child is playful.
Erythema nodosum is a hypersensitivity reaction that occurs due to a large variety of etiologies. Unfortunately, the cause remains undiscovered in a large portion of cases. It presents with erythematous, tender nodules that are most commonly located over the shins bilaterally. The nodules are round, immobile, and do not ulcerate. They may be warm to touch and painful. New nodules may erupt over days to weeks. The diagnosis is made clinically. If the presentation is atypical, then a biopsy can confirm the diagnosis. It resolves spontaneously without scarring. However, residual hyperpigmentation may remain for weeks to months. Although the lesions are relatively benign, their appearance may be a harbinger of underlying systemic disease such as malignancy. Other than symptomatic treatment, management is dependent on the underlying cause if identified.
First is describe what we see. We know that the question is that 5-year-old child who is sitting in a couch. So I will tell like that. I can see a 5-year-old child who is sitting in a couch in home setting, and the child, there is no any device attached. The child is playful, and I see that there is visible rashes on his lower limb on the anterior part of the shin, and there is no any other part of the body. I can't see any rashes. So on this, on my top diagnosis is erythema nodosum, and my differential diagnosis, it can be any trauma, is the child is a toddler, it can be eczema, it can be necrobiosis lipoidica for diabetes mellitus. Next question, what history I would like to ask. So in this case history, I would like to ask the onset, course and durations, and the description of the rash elaborately, like the rash is itchy, painful or painless, where is the exact location of the rash, is that other parts of the body are affected or not, rash associated with any fever, any upper respiratory tract infection, sore throat history present or not, and in similar condition in other family member affected or not, is that first time occur or recurrent occur, and also we ask any chronic condition present on the child or not, as we know that inflammatory bowel disease is associated with erythema nodosum, and also we ask the bowel and bladder habit in the child. We ask about TB history, exclude any TB contact persons, any weight loss, night sweating, we exclude the malignancy, and diabetes mellitus history, as we know that necrobiosis lipoidica also present in the lower part of this site. So this history we can ask in erythema nodosum video station. Next, what examination we would like to do? So examination is like we can do the first ABC, airway breathing and circulations, and the vital signs, and also the general examination, head to toe, the skin examination specially, and also we can do the abdominal examinations. So I am discussing erythema nodosum. We know that erythema nodosum is a delayed type of hypersensitivity reaction that most often presents at erythematous tender nodules on the shins, is the picture we are understanding. So etiology, this is very important. The etiology they ask in exam. The infectious causes are streptococcus, mycoplasma, tuberculosis, hepatitis C virus, and Yersinia. Then drugs, and in history we can ask the drug history, is that any drug he is taken or not, because some drugs causes erythema nodosum. So these are, it can be sulfonamides, penicillins, phenytoin, and OCP. And systemic causes sarcoidosis, lymphoma, lupus, inflammatory bowel disease. These are the etiology of erythema nodosum. Now epidemiology, it is most common in women, in their 2nd to 4th decade. Clinical presentations, as the picture, that is a tender erythematous nodules on bilateral shins, possible infectious prodrome. Nodules typically resolve without scarring after 8 weeks. Management, what is the management of erythema nodosum? It is a self-limiting conditions. We reassure the patient. We can give NSAID, potassium iodide, and corticosteroid is the second line. So if the child has inflammatory bowel disease, then we can use the corticosteroid as a treatment. And if we not treat it, the complication occur, some paniculitis like fat necrosis, ulcer necrosis, it can be developed as a complication. So this is all about erythema nodosum video station. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.